Matthew Hull, it's a THCV Spotlight, and I'm here with Raj Singh. Raj is the CEO of Accolade, which is one of the major companies in what used to be called navigation, but I don't know what it's called now. We're here actually, it's JP Morgan week, but we're down in the San Francisco office. You can see the Bay Bridge out there in the Bay. Not a bad place, Raj. You picked up, this is part of the PlushCare acquisition that you guys did.
This is part of the PlushCare. This was the original PlushCare offices, or actually the second PlushCare offices.
The first one was right next to the Health Tube office when it was Ryan,
right?
Ryan and a dog. I think
Ryan and James, and yeah, probably a pet. No.
Something like that.
Yeah.
But things have moved on a bit since then. All right, so for those who don't know, what are you reminding? You guys are a publicly traded company now, so people should know, but what is the scope of what Accolade now does?
We deliver a suite of personalized healthcare services. So the idea is we go to employers and say, your employees are struggling with the complexity of the healthcare system. That system is so complex, in fact, that they overspend, they spend in the wrong categories, and what they need is navigation or advocacy. But what's different about what Accolade does than other players in the category is we actually embed physicians into the care teams, give every employee a dedicated personalized care team that starts with a physician and guides them through their healthcare journey. When we do it, costs come down about 4 or 5% in the first year. Satisfaction levels go up, NPS scores 70, 80, and 90. And what employers see is extraordinary retention of the employees that they have because of the benefits program that they love.
So you came on board about 8 years ago, I think, to do this.
That's
and
right.
When that happened, it was a bit different. So can you explain that transition? Obviously, PlushCare is one part of the acquisition. The other things you brought on board that are now kind of, instead of steering people to other things you're delivering, give me a sense about what you do and what you steer employees and consumers to.
When we think about care teams that embed physicians, what we're talking about is primary care. Look, one of the things that I think is really interesting, Matthew, and I'll divert for a second,
go ahead.
is 72% of the population has a primary care physician. But if you try to book an appointment with your primary care doc today, it'll take you 30 days to get to them.
Yep.
Healthcare, unfortunately, happens in the here and now. And so what Accolade has done is embedded primary care physicians into our care teams. So in those moments where you need care, you can get to one of our physicians in 15 minutes, have a video visit, and then we'll push that data back to your brick and mortar primary care doc. We also do that for expert medical opinion. So if you've received a tough diagnosis, cancer, musculoskeletal surgery, or things of that nature, we'll actually get you to a specialist to determine if you're on the right course of care. Incrementally, we've partnered with companies like Virta, Sword, Hinge, Vivante, and companies across Lyra and Headspace across a variety of categories, basically weaving together an ecosystem on behalf of our customers so that when employees need a particular service, they don't have to think about what their employers are already offering. We get them right to that service, enroll them automatically, and get them lined up. And so some of those services are our own, some of those are our partners, and some of those are the brick and mortar healthcare system that already exists.
So you're hitting on sort of two things going on there. One is the access crisis, and I think you mentioned another acquisition, 2nd.MD, right? Was the
That's right.
The one which was doing this expert opinion. One is the access crisis, both in sort of the here and now for simple stuff. The other one is, how do you actually deal with the system when you actually have a real problem?
Yeah.
And I think, as those of us who are getting older notice that second issue, right, how you deal with the system when you have a real problem, is getting bigger and bigger. I'm a member of a fine, well regarded and now owned by the biggest company in the world, medical practice here, and they're fine with the primary care bit, but when they're trying to send you out into the world to get, you need the specialty care, it's a little less well connected, as I point out to them. How do you manage that issue, right? Because you talked about putting together both new kind of point solutions for things like, IBD and musculoskeletal,
Sure.
Talking about mental health, you're talking about this, that, and the other. Plus, you're not actually, in all cases, the primary care doc. Or are you finding that more and more now with the employees that you're working with, you are the primary care docs? Just give me a flavor of the experience of the employees.
A growing number of employees are taking advantage of our primary care service, and that grows every single year. But certainly, we're coordinating as well with the primary care services on the ground. But when things get complex, what we have is the capacity to actually guide people through those complex moments, whether you're transitioning in and out of the hospital. We have a transitions of care program so that our physicians and our nurses help you manage through a discharge, a readmit, or heading home, or transfer of care. We also have case management programs. So if you're dealing with a particularly challenging moment where you're going through chemo radiation, we have case management nurses who will work you through the entirety of that. We don't have to own care delivery in every element to ease the process of actually making sure you're getting the care that you need and you're doing it in a convenient, cost-effective way.
So let's talk a little bit about the physician side. You have a chief medical officer who writes the odd book and is kind of an amusing guy. Dr. Nundy's been on the healthcare blog a couple of times talking about that. And I think you have some new appointments in that area. So tell me a bit about the development out of your clinical team.
Yes, well, Shantanu, who we hired originally as our chief medical officer, has now ascended to a role called chief health officer. He's hired a chief medical officer underneath him, a woman by the name of Connie Wang, and chief nursing officer as well. And so, yes, we've added capabilities there. Look, our clinical capabilities are fundamental to how we improve the service for our customers and for our members and how costs come down. Ultimately, you have to engage with people who are experiencing healthcare, experiencing cost in order to lower cost. And look, if you were to think about our value proposition to customers, we lower cost, we improve satisfaction, and we improve retention for their employees.
All right, so let's talk about the customer base. It's still employers. Are you doing anything with health plans? Is there an interest within the sort of health plan community? I mean, and how you always look at employers and go, they should care more about this stuff. They should have more solutions that seem to reduce cost, and yet. In general, you see a lot of American employees seem to be kind of accepting of the fact that costs go up all the time and that their employees are pissed off. So I'm always wondering, why isn't this sort of segment of the market with you and a few other players, why isn't it bigger?
Yeah, well, I think a few things. One, the space is growing really rapidly, right? And so when I joined the company, Accolade was well less than 100 million in revenues. Here we are, we just had an earnings call yesterday, and we're approaching 500 million in revenues on an analyst expectation basis just next year, or this year.
Yep.
In that context, the category's grown pretty materially. More and more employers are looking at this service, and we grow every year in terms of the size of new customer acquisition. I think the question you asked earlier is also an important point, which is what are health plans doing in the category? Yeah. We've recently, in the last several years, signed partnerships with Blue Shield of California, with Priority Health. We've also signed with other regional health plans who are taking advantage of all of our offerings, primary care, expert medical opinion, advocacy, and bringing those into their customer base. The rationale for it is exactly as you described. Employers are fed up with increasing costs. They understand that there's a whole variety of offerings out there to help them. What they want is someone to weave all that together and lower cost. And what I think is most profound about what we do is we'll guarantee the utilization of their whole ecosystem. We'll drive that utilization up while guaranteeing that you lower cost. And that's something employers are more and more prone to want to buy.
On the inverse of that, I mean, in some ways, this is kind of what medical groups and primary care, multi-specialty groups and primary care groups should have been doing anyway and kind of haven't really been doing. So I think if you talk to, going back to when Marcus Osborne was at Walmart, he was saying, well, a lot of people don't have a primary care doctor or they don't really have a good relationship with their primary care doctor. Are you seeing the competition who didn't start in your place but started with the bricks and mortar, are you seeing them come towards you and start offering these navigation services, these connections, or do you think they're still kind of slow?
I think the difference is we started with the longitudinal relationship of navigation. That's where we started.
Yeah.
And so I think if you were to talk to most brick and mortar primary care physicians, they would tell you, and I think they're doing yeoman's work and trying really hard to service the needs of their members, that their panel of patients is too large and that they don't have the time nor the staff to actually bridge the gap of all the different conditions that they're facing or the different medications that they're on, and that's very difficult to do the work outside of the doctor's office in any way, shape, or form. So we started with navigation, added primary care, and because of that, our primary care physicians are sitting on a data set no one else has. Yeah. So our data set, when you see one of our docs, we know every condition you're facing, we know every medication you're on, we know every doctor you've seen, and we understand all your benefits. We know that you actually have SWORD for musculoskeletal or Hinge for musculoskeletal. We know that you have a benefit that's free of charge to you if you want to use it. No primary care physician in the brick and mortar world out there has that data, and therefore it's more difficult for them to deliver the service.
Do you think that plans and others and employers are trying to force that on the sort of the current incumbent primary care organizations, which include, by the way, a lot of big hospital systems these days, who should have the money to do this? And I'm wondering, are they moving as well, or is it only people like you who are moving the market?
I think plans and primary care practices are doing a lot of this work in the Medicare space. I think they're doing it in the Medicaid space. I think they're doing it in fully capitated models where it makes sense. I think if you were to look at the commercial space, I think the majority of that innovation is happening at companies like Accolade and our peer group.
So let's talk about that you and the peer group and the sort of level. How much penetration? I mean, it's mostly big employers, they're still the customers, right? How much penetration is there in the employer market so far for these groups, and how much further do we have to go? And then, is there a way that this can get down to smaller employers? And is there a model that this kind of navigation? Because I see it every time I see you or Owen or Glenn. I always say, why the hell can't I get this? Why am I feasting around on my own, and why can't I be a customer? And I think that, I don't work for a big company. It's the basic reason. So, is there a way this can grow?
Yes, it will. It will over time. There's 35,000 companies that are self-insured in this country, thereabouts. Don't quote me on the number. If you were to aggregate the customer bases of everyone in the category and multiply that number by 2, it still leaves 20,000, 25,000 companies to go. And so there's a lot of room. That's one. 2, we pride ourselves on being a technology and services company. We pride ourselves on having built a technology stack that on a year-over-year basis continues to lower the cost of delivery. As that cost of delivery comes down, in part driven by the leverage created by the 10, 12, 15 million people that we're serving or hope to serve in the near future, we will get to that fully insured population. We will get to markets like that, or to smaller companies. Today, I'd say the smallest company we're serving is probably 300 or 400 employees, but self-insured.
Okay, so it's getting there. All right, real quick, last 2 things. One is on your numbers. So they were pretty decent. You mentioned the number went up, 500 million, and your stock had a nice bump, which you didn't tell me about yesterday. Pretty good. I know it would have been illegal, but right. What do you expect from this company, but both in terms of sort of the numbers the next few years? How big do you think it can get? And then the other sort of related question to that is, what other services do you think you might bring in-house, like you did with primary care and second opinions? So
first, the company just announced its Q3 earnings and revenues, reaffirmed and raised guidance for the year as a whole. Entering the next year, analyst expectations would be we're going to grow about 20%. We're going to be profitable for the year as a whole. And that's an important milestone for any company in the digital health space. 5 years ago, the universe was very much about growth at any cost. We've made the transition to profitability while maintaining a growth rate that's really aggressive in the space, and doing so at about $500 million.
And not everyone else has done that. Just fair enough to point that out. But
I appreciate you saying that. I think that's true. And so. And that's a testament to the hard work of the people. But
let me ask you, pushing that forward. I'm not saying you'll be $1 billion company in 5 years, but what are your expectations about how big this could become?
In fact, we've laid out that very expectation. In fiscal 29, which is virtually calendar 28, about 5 years from now, we'll be a $1 billion company doing about somewhere between 150 and $200 million in profits. Which, when you look back on the arc of companies starting from zero, we had 5 customers when I joined 8 years ago. That's a small group of companies, and so we've got a great, incredible group of people here who are building something that we think adds value every day. It's why everyone comes to work here. Is we want to do good things for people, the people we serve, and we're making a lot of progress.
And finally, digital health sector you've been in for a while now. It had a incredible, it was bumping along. The numbers going north till the end of the 2010s, and then all of a sudden this incredible 2-year rate, bout of insanity, you might almost say, where money was flooding in from the sky, and SoftBank was running $100 million checks every day, and then it went into massive reverse. Rock Health just reported that last year was only $10 billion investment compared to like 30, 40, 4 to 5 times that a couple of years back. What do you think the prospects for this as a separate industry are in the next little bit, or do you think it's no longer a separate industry? When you look sort of big picture at all the stuff we're seeing at JPM, not the biotech stuff, but the stuff on our side of the house, where do you think this is heading?
Digital health is a subset of healthcare, and so if you were to think about this, Mark Andreessen 10 years ago, wrote an essay called "Software's Eating the World," which is the idea that whether you work at General Motors or you work at Accolade or you work at Google, you work at a tech company. All of us are building technology, and that same thing's true in healthcare. And so, there was a time 3 years ago that people talked about artificial intelligence and generative AI and large language models and said that's an AI company. Well, 2 years from now, if you haven't built the vast majority of your technology that incorporates levels of generative AI and LLM, well, then you're going to be out of business. And so everyone's going to be an AI company. Digital health is an interesting way to segment disruptors who've started from somewhere and got to some level before either they get acquired or they get scale. We feel lucky that we're one of the companies that's getting scale and moving from scale to profitability to really being able to do bigger things. But the category itself is healthcare in the United States.
Fair enough, and hopefully it will be changing for the better.
I agree.
You'll keep working a bit. All right, I've been talking with Raj Singh. He's the CEO of Accolade, which is making healthcare work better, I think is what I just coined that new term. Raj, thanks for your time.
Thanks, Matthew.